Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. What are the causes? Why people are landing into cerebral palsy? There are three categories of reasons I can say. So, what happened before birth when the child is in the womb? So, what happened? That is known as before birth or prenatal. We have to check during the birth, during the delivery, what are all the factors, and also after delivery, what are all the things that can hamper and cause cerebral palsy. First one is when the baby is in the womb or when the mother is pregnant, she can have infections, right? Can be bacterial, viral, protozoal, any type of infections can cause the damage to the brain of the baby. Mother health is also very important. If mother is having diabetes or thyroid, or she is taking any toxic substance like alcohol, tobacco, or if the mother is on any drugs, this can damage the brain of the kid. Next, genetic mutation. There are a lot of genetic mutations that cause brain damage in the womb itself. So we can have some genetic mutations, and also placental insufficiency. This is one of the most common things. So you can see that in pregnancies, when there is more than one kid or one fetus developing in the womb, they can have less blood supply, or sometimes even with single fetus, so there can be constriction of uterine artery, or there are so many pathologies that can happen that reduces the blood flow to the fetus. So mother gives the blood to the fetus, right? There is a exchange of nutrients and lot of other things between mother blood and fetus blood. When mother blood is not giving sufficient nutrition or not taking out sufficient waste materials from the body of the kid, it can lead to brain damage, that is known as placental insufficiency. And also radiation exposure. There are a lot of radiations. When you are going through airport, you are exposed to radiation, or when you are taking any walking through, or there are a lot of places where you are exposed to radiation. So if the mother is exposed to radiation, especially in the hospital, or taking x-rays, something like that, it can also cause brain damage to the kid. These are all the risk factors or causes for cerebral palsy. Next one is, what are the causes during birth? So when the baby is about to born, or when the mother is in labor, what can happen? What are all the things that can go wrong? One is birth asphyxia. So immediately after the birth, the patient or the kid should cry, the baby should cry. If the baby doesn't cry, what happens is the lungs will not filled with oxygen, and the oxygen will not go to the different parts of the body, especially brain. So when the baby is in the womb, mother is breathing for him, and the oxygen is exchanged between mother and the baby. So mother is getting sufficient amount of oxygen. When the baby comes out, immediately the lungs has to function and give supply of oxygen to the brain. If the baby is not crying and the lungs are not expanding and the lungs are not taking oxygen, so it can cause hypoxic brain damage, means brain will get less oxygen. That's the reason brain gets damage in the kids. That is known as birth asphyxia. Premature birth. So normally the baby should be in the womb for 9 months, and after 9 months the delivery should happen. Sometimes what happens is, especially around 6th and 7th month and early 8th month, if the baby is born, we call them as premature babies. Even that premature babies will have the risk or the cause of cerebral palsy. Low birth weight. Normally baby should have sufficient weight around 2 kgs, above 2 kgs the weight of the baby should be there. If the weight is below 2 kgs and even much lesser than that, what happens is it can cause the damage to the brain, that is known as low birth weight. Trauma during delivery. So there can be lot of injuries during delivery. There is forceps delivery, or cesarean delivery, or episiotomy, or suction delivery. There are a lot of different types of deliveries during this delivery, or vaginal delivery. Even during natural delivery, there can be pressure or there can be mechanical injury to the brain. This can cause cerebral palsy. And coming to the risk factors and causes after the baby is born, first one is infections, especially infections to the brain and meninges. Meninges are the coverings around the brain. Brain is well protected in some covering. Those coverings are known as meninges. So if there is direct infection to the meninges or the infection to the brain, that can cause brain damage or head injury. So we can see lot of injuries when a baby is carried or put somewhere, or when someone is shaking the baby or playing with the baby, there can be head injuries as well, which can lead to brain damage. So neonatal jaundice, one of the common diseases. So some people or some kids are born with jaundice. It can be pathological jaundice or physiological jaundice, whatever, pathological jaundice or physiological jaundice. If the serum bilirubin levels are too high for a long time, that can cause cerebral palsy as well. Lack of oxygen and choking. We can see some of the kids when we place them on cradle or when we place them on cot, they can, something can fall on their face, a cover can fall or a cloth can fall, and she will not be able to respond, and the baby will not be able to speak. At that time, what happens is there will be damage to the brain, damage to the brain. When you cover his face with something else, so he is not able to breathe and there is no sufficient oxygen to the brain, that can cause brain injury. So this is known as choking. And also there can be sometimes clots and bleeding due to any reason. So there are some diseases that can cause clots in the brain of the baby or bleeding in the brain of the baby. This can lead to brain injury. So these are all the causes after the birth. Then coming to the risk factors, what are the risk factors? So multiple birth means if there are twins or triplets or quadruplets, if there is less space and more people within that space, that is one of the risk factors. Advanced maternal age, if the mother's age is too high, so normally we see nowadays with the celebrities, they are going with the kids at later ages, so even that is one of the major risk factors for cerebral palsy. Next one is complications and the labor during pregnancy. So some of the people will be pushing for normal delivery even though doctor suggests that to go with LSCS, or they want to go to natural delivery. Even that conditions, they can be damage to the brain. And also neonatal infections, any infections of the children. So it can be bacterial, it can be viral, it can be protozoal or parasitic infections, can cause cerebral palsy in the later stages. These are all the risk factors for cerebral palsy.
Fidicus Homeopathy.